Hi, everyone. Before we start with opening remarks, we at ResCon wanted to respectfully acknowledge that we are situated on the traditional territories and treaty lands of those of the Mississaugas of the New Credit First Nation, as well as the Anishinaabe of the Williams Treaty First Nation, the Huron-Wendat, and the Métis Nation. As ResCon's offices is in Vaughan, we are grateful to have the opportunity to work and live in this territory. And then I will kick it to Andrew to deliver some opening remarks.
Thank you, Amina. We do have Dr. Moody with us. Sorry, I'm just pulling up my opening remarks. Just one second. Okay, so good afternoon, everyone. I'd like to start, as I guess we start every COVID webinar, by recognizing the work of the provincial government, specifically the Chief Prevention Officer with Dr. Joel Moody and his team, our safety partners, IHSA, and then the work of the rest of the MOL, including Brian Barron and all of the inspectors in the enforcement branch. I'd also like to recognize the other construction associations that work tirelessly and support this webinar series as well. And so again, we're happy to partner with Sewer and Water Main, the Ontario Road Builders Association, the General Contractors, OGCA, the Heavy Construction Association of Toronto, HCAT, the Ontario Home Builders Association, and ORCA, which is a group of residential and civil subtrades. So I'd like to start today by focusing on where we're at as a construction industry and trying to articulate the quote unquote temperature in the room. So everybody has spent the last 2 or 3 weeks talking about COVID. There's been lots of discussions between employers, associations, unions, construction workers, in-office workers, and the sentiment, if we can summarize it, seems to be what happened, what do we do now, and where are we going? And so while we will certainly cover the first 2 questions in today's webinar, the third question is actually one of the clearest and simplest ones that we can answer. So in order to understand where we are going, we need to look at where we have been and apply the lessons that we've learned moving forward. We're in another wave of COVID, and as an industry and as a society and as a province, we all wish we weren't here. But the truth is, when COVID flares up and a new wave comes, we deal with it. We all have COVID fatigue, but everyone that I've met and worked with, especially in construction, is quick to react, quick to adapt, and quick to find the energy to recommit to safety, when we have the spikes and when new challenges arise. So that's actually been fairly consistent, and it's that consistent approach which I think is how we're going to deal with this going forward. So what does this mean? It means you need to reconnect with your safety networks, and you need to rely on the best information, and that's what today is about. It's about working with MOL and the CPO and IHSA and the construction associations, and most importantly, with your on-site joint health and safety committees. It's about sticking to what's worked, including social distancing, the use of what we'll say is the best available mask, and COVID screening tools, as many as are available. And then finally, probably the most important is vaccination. Your first, your second, and now your booster dose. Finally, you have a whole bunch of construction associations that work together to put this together. And so reach out to ResCon, reach out to your construction association, because they're working to try and make this as easy as possible. Today, we're going to hear from Dr. Moody, the CPO, who will give us the latest update from the Ontario government on COVID. We'll hear from Mike Sherrard and his colleague, Louisa, and they're going to address the big legal questions stemming from the latest announcements, reg and legislative changes, as well as case law related to vaccine mandates. And finally, well, not finally, but we'll also hear from Brian Barron from MOL Enforcement, really looking at what we can expect on site. Finally, we'll hear from Amina and Ahid, who are going to provide an overview of the vaccine guidance sheet and give an update on government responsibility, and just give an update on what to expect and what we can do as associations and employers related to COVID. I have the pleasure now of introducing the CPO, and he probably doesn't need an introduction. He's been with us for actually not that long, but I feel like we've all gotten to know him fairly well. He's made construction a priority, and we really appreciate that. He comes to us from the electrical sector. He has multiple degrees. I was planning on congratulating him and Alabama on their big college football win, but unfortunately we won't go there. We'll have to wait another year for that. But as he needs no introduction, I'm going to turn it over to the CPO, Dr. Joel Moody.
Andrew, thank you so much. And as you said, unfortunately, some college football didn't quite go the way people may have wanted, but really it is my pleasure to be with everyone this afternoon because this is a great event. Working with the construction sector, working with the sector representatives, Andrew, getting the message out to everyone is so important. And I want to really applaud ResCom for holding these types of meetings on a regular basis. You mentioned, I'm still fairly new, about 4 months in, but I've been working with the group. My office has been working with the group. The ministry has been working with the group to support the sectors and to really be very appreciative of that partnership that we have. It's so important. We find ourselves at a challenging time. Once again, we talk about an ongoing aspect of COVID, new variants, and its implications, not just from a work standpoint, but about our personal lives as well. I don't ever want us to forget that, each of us is a worker, but each of us also has family, and each of us has our life outside of work that is also impacted. So I wanted to really provide an update to us all about some of the work and items that are coming out of the office, and we want to always ensure that you're up to date and informed. So as always, we take our lead from the Chief Medical Officer of Health, and we continue to ensure that we're in lockstep with our colleagues at the Ministry of Health, as well as Public Health Ontario. And as you know, some announcements lately related to COVID and how community spread continues to occur on a very wide spread in an infectious nature. So we've seen those challenges relating to both testing, contact tracing, case management, that is there in order to try to find the best ways to protect those high-risk settings and continue to really safeguard our hospitals and our ICU capacity. This is a big shift, and I know our workplaces have been asked to do a lot over this period of time. Andrew, you mentioned it very well, this concept of COVID fatigue. We all would like to have a break, but unfortunately, this is the time where we have to still remain vigilant. So at the ministry, we're continuing to make sure you have the most up-to-date information that is in a format that's usable, that's in a format that reflects the changes, because having clarity to our businesses, having clarity to the construction sector is so important, because at the end of the day, we don't want things that are hard to understand, because that does not serve us well. From door to door, we want to ensure that we're providing that clarity for the province as necessary. So we work with our partners, the safety associations, the Prevention Council, to find ways to amplify the messages. How do we use our channels? How do we use our colleagues? How do we use those networks that exist? Because there are some very strong networks, both from an employer standpoint, an employee standpoint, and so we want to ensure that they have that information that can amplify. We talk about vaccinations, and I am here, and I want to continue to promote and support vaccination. It is still the best way to prevent serious illness and hospitalization or death from COVID. So how do we work with our employers? How do we work with our employees in order to maintain workplace control measures to help prevent exposure and contraction of the virus on our work sites? So our online WorkSafe Plan Builder, we have had a lot of great uptake with people using that to plan what it is that they will do on their work sites, print it out, update it, ask questions that you may not have considered earlier. But now is a great time to make sure that you're asking those questions and be prepared. And as we've seen from the Chief Medical Officer of Health, and we've heard about it earlier, what are those things that we can do ourselves to decrease risk? Masking, so important. Ventilation, improving, doing best you can there, promoting physical distancing, supporting those IAPAC principles. We want to ensure and find ways that we reduce the number of people in enclosed spaces. For example, staggered schedules, posting those capacity limits, finding ways in which we can, minimize individuals who may think that they have COVID from entering the workplaces, reminding the workers about the importance of not coming into a workplace when they're sick, and decrease those in-person contacts that are not necessary. All of these measures do make a difference, and we have seen when we input those measures into place, we're able to blunt the wave, and those are very, very important things that I want us to always remember. Just as an update, I've had the opportunity to speak with ResCon and some other of our construction associations regarding or setting up vaccine clinics. And I want to thank you for those that have put your hands up and are working through that process. I don't have any more information at this time because it's operating out of our Ontario Together portal on the ontario.ca website. And once again, I can make sure that you get that information following this meeting for those who would like to go through that process. In addition, we're also getting questions about the rapid testing, and unfortunately that limited supply that's there. Our colleagues at the Ministry of Health, they have developed what's referred to as that prioritization framework, and that has been in consultation with the Office of the Chief Medical Officer of Health. And one of the big things as part of that risk framework is what are the considerations for risk within the context of high-risk locations for Omicron variant transmission. Specifically, when we talk about the highest risk of transmission, those vulnerable sectors, our long-term care homes, our retirement homes, our hospitals, congregate care settings, our Indigenous communities and organizations. And as well, each of the local public health units have prioritized to receive some supply. Do want to let you know that all organizations continue to be eligible to get the kits. However, the orders are being placed on a priority sequence and being filled. We're hoping that supply will increase soon. Once again, unfortunately, I don't know what soon is, but what we're hearing is within a couple of weeks. But once again, how that information, how the supply gets rolled out is still to be determined. So in light of this delays in the short term, how do you manage your stock that you have on hand? What are the best, most judicious ways, given these changes within the guidance, how do you also use your existing stockpile to look at both asymptomatic screening and symptomatic testing? Those are things that we would really want to understand, and how can we best help you there? We continue to work with our partners on this backlog of orders, and hopefully those will resume as soon as possible. We have been able to make sure that those updates are incorporated into the Ontario Together portal when you order, to hopefully help us signal where the delays are happening, such that if you are an organization that is applying, you'll at least have a heads up. So routine screening with the rapid antigen test still supported for those high-risk settings. And so how do we best find ways to facilitate delivery and pick up possibly even through your chambers of commerce that's still once again dependent upon the supply. So over this period of time, construction has still been operating. Things are still being built. Things are still being maintained. And even as we return back to this modified Schedule 2 setting, the work that you do is important. The work that you do is insurmountable. And I can't say enough, but the sector has shown throughout that you know how to weather the storm. And and you've done that by being at the forefront of public health measures. You've really been able to help your workers, because the workers come from the community. How do you find ways in order to make sure that what you're doing within your work site also helps go back to the communities from which they come from? And And the construction sector needs and should be applauded for that work. So I continue to be a champion for you. And because I know that you're doing the things that are right and the things that are just. So continuing to do the work. We're not out of this pandemic yet. I know that we will get there, but we still cannot let our guard down. We have to be steadfast. It's a difficult time. So stay strong, continue to do what we're doing. And hopefully with all of the tools in our toolbox, we'll see an end to this wave sooner rather than later. Thank you very much, Andrew.
Thanks, Dr. Moody, for giving us that update. We're very grateful for your leadership. And then on a lighter note, although Alabama did lose, I think you're a Duke basketball fan, if that's also your alma mater. So I don't know, March may be a bit more exciting than Monday was, but we'll see.
Fingers crossed. So,
yeah.
Amina, thank you so much.
Thank you. So I'm hoping to do we always do a group photo. So Ahid is going to take a photo, and then she'll let us know when we should stop smiling, but I think we should start smiling right now. Okay, I think we're good. Thank you, everyone. Our next speaker is Mike Sherrard of Sherrard Coos. Mike is recognized as one of Canada's leading labor and employment lawyers. He is the former chair of the National Labor and Employment Law section of the Canadian Bar Association and the Labor and Employment section of the Ontario Bar Association. In October of 2020, the Government of Ontario appointed Michael to be chair of the Skilled Trades Panel. He is the recipient of several awards, including the Construction Institute of Canada's Chancellor's Award of Excellence, the University of New Brunswick's Alumni Award of Distinction, and the Canadian Franchise Association Volunteer Leadership Excellence Award. We're also joined by Louisa, who works alongside Mike. And let me just bring up her bio here. Sorry, just one second.
Just while Amina's finding it, the link that was referred to by Dr. Moody is now in the chat for everybody. So.
Okay, so Louisa, and I'm not gonna attempt your last name, so if you want to say it later, that would be good. But Louisa advises, represents, and advocates for employers in many areas of employment and labor law. She began her career with Sherrard Coos as a law student, during which she participated in a secondment with the Ontario Labor Relations Board. Louisa is bilingual in English and Russian. Louisa is also a member of the Law Society of Ontario, the Canadian Bar Association, and the Ontario Bar Association. Welcome, Louisa and Mike. Thank you.
Mina, thank you. I'm going to try and share a screen if that's okay.
It should be.
Okay, let's see how it works.
Looks good to me.
Okay, so I just have to. And just need to switch here. I'm assuming everybody can see both the first slide, but also the second slide in terms of how this is set up.
Yeah.
Okay, I'm gonna leave it like this just in the interest of time. So what Louisa and I are going to try and do is take you through an overview of what's been happening from a litigation perspective aligned with vaccinations and all the policies that we put in place. And we're going to try to hit these 4 areas. There are now, as you would expect, there are now several decisions out there about this. I think the simplest way to put this to everybody that's listening in is the reasonableness of an employer's policy as it relates to all of the things that surround how we've been trying to protect ourselves and our employee populations from the spread of COVID. And so we're gonna run through 4 recent decisions. We're not going to spend a lot of time on them, but they're also charted on the slide so that if after the presentation you want to go back and take a look at these in particular and dig into them, you'll be able to find them pretty quickly. We'll also talk a little bit about what we're learning most recently over the course of this last month, to Dr. Moody's points with respect to the application of policies. And we're also seeing policies evolve. So policies that were simply looking at testing, some of these policies are now looking at no longer testing and actually having mandatory requirements for vaccination, mandatory attestations, and consequences for failure to do so, absent things like human rights-based exemptions. So we'll try to comment on those, and then a really brief comments on injunctions and some discipline steps where Louisa will jump in as well in terms of what arbitrators have been saying across the country, and more particular here in Ontario as it relates to discipline arising from this. So the first couple of decisions we want to talk about, we're going to go through Paragon. We're going to go through the employment safety, the ESA, so the Electrical Safety Authority case, an OPG case, and then finally a recent case that just came out from arbitrator Herman that's out of the Hamilton area, and we'll get into that case because it's the most recent comment in the arbitrable setting. So remember that many of us are reading things in the Globe like we did today about where this all sits from a pure employment perspective. What we're going to try to do on this session is really look at an employment perspective in the unionized environment, not the non-unionized, but frankly, the unionized environment for the majority of us. And we're going to try to stick to that. Paragon's the first decision. Many of you have probably already heard about Paragon. This is a company that provides guard services, and it provides those guard services, as you would expect, at a variety of clients' sites. And so the employees of Paragon are interacting with hundreds, maybe even thousands of employers and their employees. And I say that because when you're looking at the vaccination policies that we're all still looking at, and some people, as I said, are amending them and updating them, context is critical. So things to think about, just as a side note, and I'll come back to these, but for example, are you dealing with workers in your office, as an example, who might still be able to work from home, as opposed to construction workers who must come to site? And there are distinctions that we need to think about. So context is really critical here when you're thinking of your vaccination policy as it relates to whether it's mandatory or encouraged. And you know that ResCon has a template out there as well to help you if you haven't yet, because there are still some people who haven't yet put a vaccination policy in place, or they're updating it. And I really do commend you to take a look at ResCon's policy as some guidance. So Paragon puts a policy in place that says you must, all our workers must, as a condition of future employment, be vaccinated. And they define vaccinated as both shots as per public health. And I suspect you're going to see them also start to talk about boosters as well. And many of us are going to be talking about this third shot, or the booster, as many of us are calling it. The only thing I would watch for in this case, and every time you're looking at this and you're talking to your human resource professionals or your safety people, remember that in the unionized setting, deciding whether or not what you're doing is reasonable is in a framework that we refer to as an old Kbp case. So if you're trying to look and analyze how your policy is going to be looked at, especially if a union has challenged it and they've said, we believe it's contrary to privacy, it's not, simply put, it's not reasonable, it's not a reasonable exercise of management rights, when you get to an arbitration, they're going to look at the Kbp principles, and they're going to look at these and these are the 6 things you want to think about. So I'll read those off really quickly. The policy that you put in place must not be inconsistent with the collective agreement. It must not be unreasonable. It must be clear and unequivocal. It must have been brought to the attention of the employee affected before you actually act on it. So the notice is pretty important. Employees concerned by the policy must be notified of the consequences of the breach of the policy. So they have to know what's at stake in terms of their adherence or lack of adherence to the policy itself. And then finally, the 6th point that KBP says we should look at is the company consistently enforcing the policy that was introduced? So really important. The Paragon case has a quite unique section because they say, think of KBP, is the policy inconsistent with the collective agreement or not? And what's quite unique with the Paragon case is that the collective agreement that Paragon had with Local 333 of the UFCW actually had an article that said the following: if an employee is assigned to a site where specific vaccination and/or inoculation is required by law, or where the conditions of contractors having access to the site stipulate specific vaccination and inoculation requirement, the employee must agree to receive such vaccination or inoculation. I'm not sure I can tell anybody on this call that I've ever seen an article like this one in this collective agreement that was entered into 5 years ago. So this is a clause that was around way in advance of our unfortunate circumstance of the COVID pandemic. But it's because of this specific clause, I suggest, that was a big focus of arbitrator Von Vey in this case, finding that the policy was actually reasonable. First thing that he found was that the policy was in fact consistent with the collective agreement. And I would suspect for most of us, when we look at our own collective agreements, we may in fact not find that kind of language. Next, if we look at the Electrical Safety Authority case, this was a decision, I believe, written by arbitrator Stout. Ultimately, in this decision, we're talking about the inspectors who go onto sites employed by the Electrical Safety Authority. But in this case found, as you can see in the bold on the slide, that the policy that required all employees to disclose the vaccination status, there was no testing alternative. And if they had chosen not to disclose, and ultimately there were disciplinary consequences. Arbitrator Stout goes a long way to say, at this point in time, in this context, now he does go through KBP, but he actually finds the policy put in place at the behest of the PWU grievance. He finds that policy to have been unreasonable. Now, he spent some time, and he really does focus on context. And so what I'd say to you is, when you look at the ESA authority, a couple of things that happened. They did a very good job with respect to all the alternative means of keeping people safe. And you heard that from Dr. Moody, those ones that we all know, whether it's social distancing or active screening or all the PPE that most of us are still obviously using, even in COVID fatigue. He finds in this context, they didn't have a problem. They had many people working remotely, number one. Number two, they didn't have outbreaks, and that their current safety protocols were in fact keeping people safe. And he found, as a result of that, moving immediately to discipline or discharge consequences as a failure to have a vaccination wasn't considered reasonable in that context. So keep that case in mind as we go forward. The OPG case, a little bit different, right? This case isn't just about the vaccination policy. It's actually about looking at testing. Now, you'll remember that early on in our sector, we looked at the Alice Dawn case with the laborers and the reasonableness of their testing protocol back in the projects that were down on the waterfront. This case, I believe it was arbitrator Murray, so John Murray, formerly from the Ontario bench. As an arbitrator, the issue here, PWU was arguing about who should pay for testing, both the kits themselves, but also the time involved in testing, because Their policy said, we're going to have people self-test. We're going to have them do it at home. They're still going to send us the evidence of the outcome of the test. All of it's going to happen before the shift, which for many of us, that makes sense because we're going to catch people before they get into the workplace if, in fact, they unfortunately have a COVID positive test. He says the following: I still believe the employer ought to pay for the cost of the kit, but I don't believe the employer should have to compensate employees for the time spent outside of work self-administering. So he finds two pieces on testing that I think give us some guidance for future. Many of us are suffering from what Dr. Moody talked about too. It's hard to get sufficient amount of kits right now. So there are some strategies to be thought about with respect to how you actually use them. And I really look to one of the practical comments I think I've heard over the last week or so is anybody who believes they have a symptom or is suffering from symptoms. So a lot of people are looking at that person and saying, don't test, stay home and isolate. And I think given our problems around testing right now, it's a reasonable direction. And so many of us, and certainly in our firm as an example, if somebody was suffering from symptoms, we're not requiring that they test, we're requiring that they isolate. And then finally, the last one was that Arbitrator Murray does find that it's reasonable to put somebody on an unpaid leave, potentially terminating as well, he goes on to agree with in their policy, if somebody fails to have the vaccination and or attest to the fact that they have the vaccination, absent the exemptions that we've all talked about under the Human Rights Code. In this one, I think it said something like the person would be put on leave if they didn't have the vaccinations and or they failed to attest to such without any kind of a human rights based for at least a 6-week period. He's fairly clear in his comments near the end that suggests that, my words for a moment, buyer beware. If you fail to get the vaccination and you're put on unpaid leave, you ought not to be surprised if you're ultimately terminated. And I think that's some of the direction we're starting to see. This last case, most recent, this is Arbitrator Herman. I won't spend a lot of time on it, but Arbitrator Herman does take into consideration the cases we just went through, and he ultimately finds the mandatory vaccination policy at this company to be reasonable. There's a twist in this. Remember, I said context. In this context, this company has a property where its employees go to work on a port authority, a federal port authority lands, and it's the federal port authority that puts in place a policy. So this isn't just simply Section 25(2)(h) that we all talk about, every reasonable precaution. It's actually your landlord is saying to you, only people that come on my property are those who are vaccinated and who have attested. And so it's in that setting that might not apply to all of us, but we are seeing some people move to this and then requiring anybody attending their property to have the same kind of a policy. In those settings, this case is supportive of an employer's position that you must mandatorily vaccinate and you must attest. They put in place, as you would expect, lots of privacy rules around the protection of the information. They narrow the information they want, and they talk to their employees about only providing specific information around the vaccination status itself, eliminating everything else. They have a process by which it's a need to know access of that information. So they do a fair bit, as he records in the decision, to alleviate any of the concerns around the privacy and or health information issues. But ultimately, he says they're bound to the landlord's policy. I find this to be minimally intrusive when I look as against not doing it and all the consequences of the spread of COVID. He also comments on the amount of advance notice that they provided the employees of the need to attest, and he gives them a certain period of time. And the policy actually also says, if you've only got your first one, you'll be put on unpaid leave while you get your second one with a period of time. And some of us are now looking at that with the booster shots as well. So keep that in mind. And then ultimately at the end of this, it said unpaid leave with potential consequences. So it doesn't go automatically to discipline discharge. It's an unpaid leave. And he says in the decision, I'm not commenting on if you terminate in accordance with this policy, whether or not you had just cause to terminate. I'm commenting solely on the reasonableness of a policy that could lead there. So he's leaving that individual assessment for all of us to take a look at. So important cases to keep abreast of as you start to look at what to do next in terms of your workforce and whether you're going to, and I keep saying this, include the booster, because I think that's coming for most of us. These two charts are really for later, but we wanted to make sure we laid out a couple of charts to give you these reference points. And thanks to my colleague Louisa for doing that. We're hoping those will be quite valuable to you. The injunction cases, if I was to sum up, these are injunctions where they're actually still have a unionized setting, but somebody's going off to the courts to try to get an interim injunction to stop the application of a policy coming into force. In each of these cases, I'd say courts are reticent to get involved when there's an arbitrable setting available to the litigants. So whether it was a union or an individual, in most instances, our courts have said, there's already an arbitration pending. You can expedite the arbitration. We ought not to jump into that foray. We leave it to the arbitrators to deal with. I think this is where I'm going to hand it over to my colleague Louisa, and I'll move the slides as you want.
Sounds great. Thank you, Mike. So another development that we're seeing right now in the case law surrounding COVID-related policies is disciplinary grievances. So these are actually coming out of workplaces where workers are refusing to follow the policies that employers have in place regarding disclosure requirements, for example, around symptoms of COVID or about the proper use of PPE. So we're going to walk you through 4 of those cases that have come out of arbitrations. The first one being Hydro One and PWU. So this is basically a failure to mask quasi-accommodation case. In this case, Hydro One implemented a policy which required its employees to mask, and one employee requested religious accommodation around this masking requirement. He specifically refused to wear a mask on the basis that it went against his conscience. The employer didn't actually grant this accommodation and treated it as insubordination, but subsequently offered this employee an alternative accommodation. The employer offered the employee this, it's something called an arc flash hood, which if you've never seen, looks like almost like a raincoat that goes over your head, covers your shoulders, and has a visor sewn into it. The challenge came up later on when this employee had a driving assessment at the workplace, and because of the nature of this visor, it blocked his peripheral vision, meaning he couldn't actually drive in a safe manner. So the employer asked for that 15 minutes for the employee to switch on into a mask. The employee refused, and after further discipline, eventually the employer had no choice but to terminate employment. Arbitrator Stout considered this case and said ultimately the violation was serious, but there was no nexus between the refusal to wear the mask and his religion. He also found that this employee, funny enough, had previously worn masks in other situations. There was a fun fact where he had driven a motorcycle and was comfortable wearing a mask in the past to prevent bugs from flying into his mouth as he was driving. The arbitrator importantly noted that personal preference doesn't provide an exception to a policy on religious grounds. And basically, because there was a just cause to discipline for such a blatant violation of health and safety rules, some discipline was warranted, but the discharge was ultimately excessive. And so arbitrator Stout determined that instead the employee would be given 30 days as a last chance to comply with the employer's requirement to wear a mask during the driver's assessment. Another case that we're going to cover is Garda Security Screening Inc. and IAM District 140. This case actually came up out of events right at the beginning of the pandemic. This was a case about failing to self-isolate. So right in and around March 2020, the employer informed its employees that Canada Public Health Agency guidelines required for isolation whenever an employee was awaiting the results of a COVID-19 test. The griever was an airport worker who tested positive for COVID, and right after testing positive, the employer put her on a leave of absence. She was required to return to the workplace after the isolation period, but the employer later discovered that she had actually attended work during that self-isolation period and also misrepresented to the employer that she had not been at work. She claimed that the reason for coming in was because she didn't actually feel sick. Arbitrator Keller reviewed all these facts and upheld the discharge, finding that there was just cause for termination. And he took into account the fact that the griever hadn't actually shown any remorse or acknowledgement about the fact that by coming into the workplace during that self-isolation period, she was putting her colleagues, the general public, and other workers at the airport at risk. And so given how prevalent the virus was at that time and news, everything that was circulating about COVID, Arbitrator Keller found that it was highly unlikely that she would have been unaware of the risks of showing up to work during a self-isolation period. Interestingly as well, the employer in this case had a code of ethics that it required every single employee to sign off on an annual basis. And so this was something that Arbitrator Keller also took into account when considering the employee's dishonesty. We're going to turn next to the third case, which is, and I apologize in advance if I'm mispronouncing it, it's Seeds contre Résidence Saint-Vallier Oué Inc., which was a case coming out of the Quebec Administrative Labor Tribunal. And this was actually an unjust dismissal case coming out of a long-term care home. The employer housed residents with various mental health problems and disabilities, and the employee there worked as an attendant. In December 2020, the home had a COVID outbreak, and about 21 of the 23 residents at the small home tested positive for COVID. So to manage this outbreak, the employer implemented hot and cold zones throughout the workplace, depending on the nature of transmission. So areas that were more likely in which COVID would be transmitted were designated hot zones, and additional PPE requirements were put in place. So this particular employee was warned on one occasion during a single day 3 times about the fact that he hadn't actually been wearing the proper personal protective equipment. He was required to wear a mask, visor, gloves, and a gown. He acknowledged that he wasn't wearing them, said he would put them on later. You know, this kind of kept repeating itself throughout the course of the day until ultimately the employer asked him to leave the premises. So in reviewing this, the tribunal ultimately found that the termination was excessive and a 15-day suspension would have been more appropriate. So it substituted the discipline. Interestingly, though, it ultimately concluded that reinstatement wasn't possible. So this employee wasn't put back into the workplace. The commentary here that we find interesting is the fact that the tribunal really seemed to grasp onto this idea of progressive discipline and the fact that even though this employee committed multiple violations in a certain day, this wasn't enough, and they needed to take into account the fact that this employee could have been coached to correct his behavior, particularly because the employee showed that he understood his actions were inappropriate, that he wasn't taking it seriously enough. One of the reasons as well, there's some suggestion in the case that reinstatement wasn't appropriate was because this employee had also mentioned to his coworkers that perhaps the pandemic wasn't as serious as it was being made out to be, and there really wasn't this huge requirement to put on personal protective equipment. The very last case that we're going to look at today is Johnson Controls Canada and Teamsters Local 419. This also was a disciplinary grievance discharge case in which the discharge was upheld. And in a nutshell, this case was about failing to disclose symptoms. What's notable here is that the employer in this case was providing maintenance services at Humber River Hospital, where the griever worked as a technician. And the hospital setting is important because, as you heard Mike say today, context is critical. So in this particular case, the griever had called in sick and tested positive for COVID. The employer did an investigation and realized in the 5 days leading up to calling in sick, the griever had actually been coughing and exhibiting multiple symptoms of COVID in the workplace. but had on multiple occasions leading up to that day misrepresented his symptoms. He specifically didn't attest to having experienced any upper respiratory symptoms. And later on, what the employer discovered was the griever claimed he didn't want to attest to those symptoms because he believed he didn't need to, that they were allergy symptoms. So ultimately, the discharge, as I'd mentioned, was upheld. And even though this employee had a long tenure, it wasn't enough to mitigate the fact that he had a prior disciplinary record. In the past, he had multiple instances where he'd falsified work records to the hospitals about the hospital safety systems. He actually failed to use safety devices that were required to be used by all hospital employees. And so in weighing all of those factors, arbitrator Gedeloff determined that termination was appropriate here, and that his subjective belief about the fact that he didn't need to disclose wasn't enough, and that he ultimately deprived the employer of making that determination and that decision as to whether or not the symptoms really were allergy related or COVID related. And so in a nutshell, to kind of summarize these 4 decisions and what we need to be mindful of, pre-COVID, serious violations of health and safety have been enough to warrant termination for cause. But again, context is critical. And even in COVID-related cases, we want to be mindful when we're imposing any kind of discipline as to, whether or not there's a disciplinary history for this employee, and is that disciplinary history related to the offense that we're looking at imposing discipline for. And importantly, has the employee shown remorse as of today and realized that his actions or her actions were inappropriate? And that takes us to the end of the disciplinary grievances portion. So I'll take it back to Mike. I know we have a brief Q&A session scheduled.
Okay, and we'll stop the screen share. And maybe just to wrap up, just before we jump to the Q&A, we're not here today to say, hey, you must now put in a mandatory vaccination policy. What we wanted to accomplish today was to give you some of the cases that are assessing those employers who have in fact put that in place. We're seeing a move toward that. It's very context specific. You want to think of 5 or 10 things as you're walking your way through this. It starts with context and reasonableness. So you want to understand, is there a government mandate? Or to Dr. Moody's comment, what has public health said about whether or not we need mandatory vaccination in a particular workplace? What does health and safety say? And remember Andrew's comment as we started today, get your joint health and safety committees involved. There was some critique in the Electrical Safety Authority case of the failure to have involved the Joint Health and Safety Committee. Context, are you sitting on a property, or are you working for a landlord or an owner who puts their own mandatory policy in place? And is there actually a problem that you can identify that you've not been able to solve through less intrusive means? And it really is all about less intrusive means. We know we have COVID fatigue, but can we still make sure that we look at our folks and we make sure they're actually wearing the appropriate masks, and they are wearing them, they're not hanging around the chin? Are we screening, or is there active screening, and are we keeping our records? Outbreaks or not, records of those. Testing as an alternative, will it still work or not as testing kits start to become harder to get our hands on? I think that's starting to become doubtful in terms of an alternative to a mandatory vaccination policy. Watch your privacy issues around how this information is collected if you are asking your people to attest. And then finally, lots of warning of when these policies will come in place, what you're going to do or not do about the requirement for a booster, advance warning, and what are the consequences of failure to do so. And then at the end of the day, again, try to be reasonable. We know we have multiple different populations with views on this, but hopefully this quick arbitration update will have helped, and certainly will help off these kind of calls if anybody needs anything. So with that, I think I turn it back over to Odd. You're going to lead us through a Q&A. If there are questions, we'll try to answer. We'll see if you can stump Louisa or me.
Yeah, thank you guys again for that. So we do have a few questions. The first one is, I have several vaccinated workers who feel very worried about having unvaccinated ones in the workplace. Despite protocols in place, 1 or 2 have stated if we stop testing, they will do a work refusal. So what do they do in that situation?
I think we asked Brian, who's up next.
Yeah.
Kidding, but it's good that he's with us, because I know the ministry is dealing with these things, and I think of the protocol around Brian's group has always been educate first, in terms of how they work through that, and that's really helped us. But I think if you in fact have a work refusal, we have a process we have to follow. You have an internal process, and if that doesn't solve itself, you're moving to advising the ministry. The ministry will come in and investigate, or they'll do so virtually, I think. But I want to stop there. I don't want to steal Brian's thunder. I suspect he'll take us through some of the recent experience around this.
Yeah, I think most people's concern is now with reporting, specifically now that rapid tests aren't very available. So how to report, who to report to. So I think Brian will definitely help us with that. But thank you again, Mike and Louisa, for being with us. It's always very good to have you as a part of our events. And it's always important to get these legal updates. Next, we do have Brian.
I think there's a couple more questions in the chat. Yeah. One of them is the employer required to pay a worker while they are under a self-isolation period or have tested positive?
Yeah, it's subject to the circumstances. Generally, the answer is no, but we have seen employers have in place. There is some sick day issue. We know that is way back in April, I think, is when that first came in place. Many people have exhausted that, but we have seen employers voluntarily put in place one instance. I've seen employers do one instance 5 days, but that's not the requirement. So just to be clear, you may have a policy on it, but I haven't seen that to be a requirement.
Perfect. So again, next we have Brian. Brian is the Senior Manager of the Construction Health and Safety Program at the Ministry of Labor. He has been with the ministry since 2004, where he started as a construction health and safety inspector and worked through various roles prior to becoming the Senior Manager of the program. Brian will be discussing COVID-19 protocols as they relate to the construction projects. Thank you, Brian, for being with us, and the floor is yours.
Thank you very much. And I will answer some of those questions for you sort of at the end of my presentation. So I'm just going to share my screen. So the presentation that I've got for you today, it really kind of like pares down the actual kind of all of the COVID precautions and that sort of stuff as they apply to construction. Now I'm hoping that everybody can see this on full screen and it's not.
Yeah, it looks
perfect.
good.
Okay.
Yeah, looks good.
Great. So in general, there's a couple of things that I want to kind of talk about. So we basically got, my presentation, we're going to go through, kind of the general precautions that have been in play for quite a while now that you should be very familiar with. And I'll have some comments around that sort of stuff. Then we're going to go through some of the new requirements. So the impact that we've seen as a result of kind of not having the PCR testing available to most workers and that kind of thing. And then also a couple of future concerns that I have as well as a result of some of the things that you guys have actually brought up in terms of worker absenteeism and that type of thing. Now, first off, what I do want to say is, and I don't want to repeat a lot of what Dr. Moody and Mike and Louisa brought up, but I think it is important to note here that in the construction industry, we've been fortunate enough to have, or that we really haven't been impacted by a lot of the closures as a result of going back into step 2, as well as the capacity limits. Construction right through, with the exception of sort of right in the beginning of March 2020, we've kind of, we've been allowed to work, and in some cases the industry's actually really kind of boomed. And I think it's really important to kind of recognize that and recognize the fact that we really do need to have sort of all of the precautions in place and really respect them. A couple other things that I do want to talk about as well is, some of the success that we've seen in construction is largely as a result of the environment that we're in. We have a ton of ventilation. In a lot of cases, construction projects aren't buttoned up right until the very end. A lot of air movement, that sort of stuff. So what I would say is, if you are seeing people starting to sort of relax a little bit on a lot of the precautions, that sort of stuff, stay on top of them, because it's really, we're very fortunate because of the environment. If you change that environment a little bit, you will have a bit of a different outcome. So I think we really kind of need to take a look at that and realize that, we do need to take this stuff seriously. So jumping into this, so first off, these are kind of the requirements that have always, or have been in place for quite a while anyway. First and foremost is screening to ensure that COVID positive workers are excluded from the workplace. Now, with a lot of the testing, so the rapid antigen tests that had gone out to construction projects, this made it a lot easier. It was a very sort of firm, a firm answer to any sort of problems that you had and that sort of stuff. And my hat's off to the construction projects that undertook this, because it was actually pretty time consuming and that sort of stuff. But what it did was it gave a lot of workers kind of this peace of mind that they were working with COVID negative, colleagues and that kind of thing. So it's become a little more difficult, but that's not to say that regular screening doesn't work. Now, there are additional challenges with that, because it's, if somebody just wants to tell the truth, or let's say they're asymptomatic, it's not necessarily going to catch that. But you still need to screen all of your workers prior to entry to the job site. The next one is source control masking. So source control masking, really having sort of like those one-ply masks now, or just that piece of fabric, that's old. Don't do that anymore. Switch over to like a procedural mask, something that's got a fair bit of weight to it. There's a fair bit of documentation out there to show that those multiple layers really do a fair bit to control the spread. Or when you're dealing with personal protective equipment. So if you have to have interactions with the public that may not be masked, or they've not been screened and that sort of stuff, you'll want to switch over to personal protective equipment. And when I talk about that, it's about having a rated mask, so an N95, KN95, something along those lines, as well as eye protection. But the important thing to note is when you're dealing with those N95s, and that's been really kind of a topic that is front and center in the news right now, is it doesn't do anything unless you've been fit tested. So for somebody like me that is wearing a beard, I put a KN95 on, or an N95, it's doing nothing more than my source control mask. It really, you have to have it fit tested to actually have it work as a respirator. Otherwise, it's just a glorified source control mask. So keep that in mind. So when workers are saying, oh, I want an N95, sure, maybe you guys can make that happen, but in the end of it, you have to be fit tested for it to actually be considered a respirator. Physical distancing where possible. In construction, there's a lot of two-person lifts, people having to work very close together based on the type of work that they're doing. It's going to happen. Bottom line is where you can physically distance, make sure you physically distance, make sure that the paths to and from work areas are controlled so that people are traveling generally in the same direction, that type of thing. And then when we take a look at things like lunchrooms, break rooms, which, depending on the site that you're on, they're not overly common, but ensuring that you stagger times as well, so there's not as many people in the area. It gets into a bit of that capacity type discussion, but making sure that there's enough room between people, or impermeable barriers between them while they're eating because they can't wear a mask. Hand hygiene, an appropriate washroom and wash-up facilities. The construction industry, and I have to congratulate everybody, we've done wonderfully with this. This is something where we actually pretty much crippled the washroom industry. They were not able to kind of keep up with the requests of the constructors out there, which basically means that people are asking for the right equipment now. Now they're coming on board, and we're getting great equipment sent out to sites. But bottom line is you need to ensure that the washroom facilities are kept sanitary, and then that there's the wash-up facilities so workers can wash their hands. Reduce capacity in common areas. So I already went through that. Case and contact management protocols. So, if somebody does test positive, if they come to you and say, listen, I'm positive, you need to have those protocols in place to ensure that you can go back to the workers that were working around them and talk to them about the positive test as well. Outbreak protocols. So if you're in an outbreak, you really need to follow sort of the public health guidance in your local unit. And then risk assessments to determine what can be done, what should be done, what really shouldn't be done in that scenario. So when we're looking at sort of that physical distancing, are there things that you can hold off on? Could you find a different way to do things so that you're not having to put a whole bunch of workers together? Could you schedule things differently so that trades are coming in at different times? And then obviously working in well-ventilated areas, which, that's something that we're really fortunate in construction for the most part to have decent ventilation. Unfortunately, we don't see that in some of the other sectors once the buildings are actually complete, especially when they're dealing with older buildings. Certainly something you need to be aware of. Now, testing protocols. This is where we get into some of the new stuff. So really kind of due to this Omicron variant and really kind of, the incredible spike that we've seen in cases, we've had to revert back to step 2 in the roadmap to reopen. What that has really meant here is that the PCR test that everybody were going to actually go and get their confirmation of the results, that's really not available to most of the public and the workers. Those are being reserved for people in the highest risk setting. So healthcare workers, people in correctional facilities, long-term care facilities, group homes, that sort of stuff, where we have a bit of a crisis with workers right now, where people are off in isolation. But ultimately, we still need to be able to maintain a certain number of workers to be able to treat people with COVID and in these types of situations. That doesn't generally apply to construction. So where does that leave us? It really leaves us in a situation where, our workers and even just kind of people with symptoms, and I'll go into sort of what those symptoms are in the next slide, but where they've got those symptoms, and very similar to what's already been said, it's look, don't even bother testing, just presume you have COVID at this point. Now, you're going to say, well, it might be a cold, it might be some of these other things. It could be, but bottom line is, with the spread of this particular variant, you're to presume that you have COVID and isolate appropriately. Now, with testing, so if you do have access to rapid antigen tests, again, that's not really seen as necessary, or previously wasn't seen as a COVID positive test. It was a good marker to say that, yes, there's a high likelihood that you are testing positive. But bottom line is if you are testing positive with a rapid antigen test, you are to presume you're COVID positive as well. And again, that PCR test likely is not going to be made available to you to confirm that. Now, when we get into the symptoms, so it's really kind of, if anybody has one or more of the symptoms that are on the left-hand side of your screen, so the fevers, chills, cough, shortness of breath, decreased smell, taste, that sort of thing. Bottom line is those, you presume you have COVID, and that's really it. And then on the right-hand side, you've got the 2 or more. So it's runny nose, headache, extreme fatigue, sore throat, muscle pains, and then the gastrointestinal symptoms. So now that gets into a bit of a different discussion as well in terms of the isolation periods, which I'll get into here. So when we take a look at the actual isolation period, so if you are presumed to have COVID at this point, so you've got the symptoms or you've tested positive with rapid antigen testing, you're to isolate for 5 days if you're vaccinated. And that's two of the approved doses that are out there. There is that single dose, I think it's Johnson & Johnson, but I'm not even clear as to whether or not that's used in Ontario very widely at this point. But you're basically seen as fully vaccinated if you've got 2 of the doses. The booster dose, we're not quite there yet, so you don't have to have the booster to be considered that. Or 10 days if you're partially vaccinated or unvaccinated. Okay, so it really changes. So this is a significant departure. It used to be 14 days and it went to 10 days. Now 5 days for vaccinated, 10 days for unvaccinated or partially vaccinated. Now, workers can return to work after the appropriate self-isolation period if their symptoms have improved for 24 hours. Okay, so it's improved during it, or perhaps you're asymptomatic during it, or 48 hours for gastrointestinal problems. Okay, so that's where kind of that difference in the symptoms comes in. But bottom line is, do not go to work if you're in isolation. Now, in construction, this becomes a really difficult topic. And primarily because in a lot of cases, the employment relationship doesn't necessarily mean that you're going to get paid while you're off. So if you're a self-employed person, there is going to be a desire to go in to continue so that you continue to get paid. That's a problem. We can't have that sort of thing because you are exposing other people. So workers really do need to go into work. And to build on what Michael had said earlier, that's not a lot of those 5-day payment programs. Those are voluntary programs that employers have come up with. I do not believe right now that there is anything right now saying that you have to pay that as an employer, but you really do have to think about sort of the rest of your workforce, and it may be in your best interest to undertake something like that. Now for reporting. So section 52.2 talks about occupational illness reporting to the ministry. This is something that in the early days, it was we struggled a little bit to understand how this would apply. It does apply to COVID cases that are from the actual workplace. So if an employee comes to you and says, listen, I've contracted COVID, and they say it happened at the workplace, and there's pretty good evidence that it did happen at the workplace, they were working with other workers that tested positive, that sort of thing, you do have to fill out an occupational illness report. So that's under section 52.2. It would be sent in to us, and then we would investigate and take a look at a number of different factors, but it could include either a in-person visit or an over-the-phone visit, depending on really kind of what's reported to us. Bottom line is you really want to make sure that you've got all of your COVID precautions in place, that you want to have all your policies and procedures in place so that you can rely or like kind of really fall back on them. A couple other points here. So when we're getting into sort of the business planning perspective of this, and this is kind of really kind of the future concerns that I have at this point, is these changes in the protocols, the testing protocols, have really kind of led towards absenteeism in a lot of sectors, not just construction. What that really kind of means to us here is you're going to have delays in production, you're going to have delays in delivery and delays in service. And especially when we're dealing with sort of closing of houses and that sort of stuff, it could mean that closing dates get moved out and that sort of stuff. That is an uncomfortable position for people to be in. You may have to reschedule or cancel that work until you've got the correct number of workers or qualified workers to actually undertake the work. And where my concern really is with this one is if people turn around and let's say it's a 2-person job, but you really only got 1 person. Well, you know, is that person really going to try to do that 2-person job? And is that going to lead to incidents as a result of that? And it likely will. And that's some of the concerns that I have. So, you know, when we're looking at this, it's a matter of really kind of acknowledging that frustration. We can appreciate that. And I realize it's easy for me in the government to sit here and say things like that. But when it really comes down to this, we really have to respect this. This is something where, look, if you're allowing people with COVID to come back to work when they can't, you know, you're going to expose everybody else. You're going to be in a worse scenario kind of thing. So you got to keep people off. You've got to reschedule your work. But the other thing that you need to understand as well is all of these delays are going to lead to frustration. So whether it's with owners of houses, whether it's, you know, I know there's not a huge customer interaction between most construction and that sort of stuff, but even other co-workers and that sort of stuff, there will be frustration around it. There will be potentially some abuse of language, that sort of stuff. And you really need to ensure that you've done your appropriate risk assessments to take that into account to ensure that your workers are protected. So that's kind of it for the main part of the presentation. Now, in terms of work refusal, so I do want to get to that question because it's a bit of a big question, and honestly, it's a little bit of a tough question. So a work refusal, you have to be able to prove that there is that the worker is endangered. So just having it so that people aren't necessarily tested, that likely wouldn't be something that would trigger a likely to endanger, you know, kind of declaration by the inspector at that point. But it really depends on the workplace and the case specific information that we actually get. But where you do get into valid work refusals is if, say, people have come in, they're exhibiting signs of COVID, they haven't isolated, or you don't have any precautions in place, workers aren't wearing their source control masking or PPE correctly, and that sort of thing. That's where you start to get into a bit more of a, you know, a gray area and something where we could rule likely to endanger in that particular scenario. So what I would say is make sure you follow all of your local public health unit recommendations that are out there. Make sure that you're following all of your policies and procedures that you have in place. Make sure that you're actively supervising your workforce to ensure that they're wearing and using all of the equipment and procedures that you've put in place. And make sure you're really on top of that screening. If somebody does refuse to work, and they can do that, they can call in. You have to follow the section 43.3 process. where you've got to investigate. And then once it gets to stage 2, that's when we get called in. But it can be a tricky one with this one. Now, I'm not sure if I can see the other questions or not.
I'll ask them to you, and then everybody can
Sure.
hear it. We'll try and keep it nice and clean. So I'm going to go to one from Tanya. And it's a really good question. So I'm sure everybody knows someone who's tested positive on a rapid test. They did their isolation. They think everything's great, and then they still keep testing positive on the rapid, but they've recovered, they feel great. So in that case, like let's say you're double vaccinated or triple vaccinated, you've tested positive, you isolated for 5 days, you test on the 7th day and the rapid test still says positive. What do they do?
You can still actually continue to test positive later on. Bottom line is it's the isolation period. So if you are fully vaccinated and you've gone the 5 days, you can go back. This is a problem that actually came up very early as well, where somebody contracted COVID, they isolated for the 14 days and they continue to test positive after the fact. That can happen. You can still continue to test positive. Bottom line is make sure you keep a record of when they originally tested, keep a record of their isolation period, and then that shouldn't be an issue.
Okay, next question. So this one was from Sandro, clarifying from MLTSD. So has the government of Ontario officially recognized that COVID is transmitted through aerosol dispersion?
No, not specifically to say that it's gone through aerosol, because it's still basically that droplet protection, which is why we are still looking at source control masking.
Excellent. And then this one wasn't really asked, but they kind of got to it. So essentially, there are some people still in the province that, may be anti-vaxxers or don't want to be tested, who might have an incentive to not be honest on the screening. As an employer, we're there to provide screening. If we suspect someone isn't being honest when we're providing screening, like maybe they have COVID, what's the obligation of an employer in that situation?
So an employer always has the ability to deny somebody access to the work site. But it is really something that I would say that you should go back to your legal counsel to talk about really what's reasonable. The fear here is that you violate somebody's human rights and that sort of stuff. And there's a lot of things that you have to take into account. And I'm not sure if Michael's prepared to talk to something like that or not, but I think you do have to be careful with what factors you're considering when you are excluding somebody from the workplace.
We'll pause if Mike's there. We'll add him back in here.
Yeah, Andrea, just really briefly, context specific. There are some policies that actually put in place consequences if somebody fails to provide that truthful information. I think in that Hamilton case that we talked about it on one of the last screens, actually had a policy that said you could be trespass noticed for 6 months, putting your employment at risk as a result, or there was a monetary fine as well. But I agree with Brian's point. You got to go back and look at the context. And are there warnings and cautions? Because you will get into that gray area about, okay, so if I think the person is not telling me the truth, how do I actually get to the truth? I appreciate Brian's first point, right? Every employer has the right to object to somebody coming onto their workplace, but you will move into that health information privacy piece. I still think an employer with the right policy can work their way through that to getting the accurate information and or defending not letting somebody come to work.
Okay, excellent. Thank you guys for that. Another question, and I think it's a good one too. So running through the different situations. So essentially, let's say, a family of 4, 2 parents, 2, let's say, young adults that work. Let's say the son or daughter tests positive. Everybody in the family then has to isolate with that person. If they then get symptoms, then they have to isolate themselves. And I guess the third scenario is if you're the first person in the family who gets COVID, you do your 5-day isolation and then you give it to other people in your family. What are you required to do now that you've already had it and done your 5 days, even if people in your house are now getting it? Hopefully I didn't make that too confusing.
So that's something that I'm actually going to have to I may have to go back to actually get an answer, a specific answer on that one, because I don't know if it actually compounds. My understanding is that it's really 5 days from the day that you've either been presumed or tested positive, or 10 days, depending on your vaccination status. But I don't know whether you continue along. I don't believe you do, but I don't want to give bad information. So what I can do is I can follow up and get back to you on that.
Perfect. And then we'll get that answer back to everybody here. Last question. So I'm not trying to ask you to speak for public health or WSIB, but thank you. I think you clarified it, what needs to be done and when a report needs to be filed with MOL. Can we ask the question, what's the relationship that MOL has with WSIB or public health? So I know I've got to report to MOL, right? And then what's the interaction with public health and WSIB with MOL? If that's a way to sneak in a question there.
Well, I think it really depends on, are you making a claim to WSIB or is it just an occupational illness that's being reported to us? And I really can't speak for what WSIB would do for that or whether they even cover a lost time injury for that type of thing. I really don't know that. In terms of public health and the Ministry of Labor, we do work together on some of the science tables and that sort of stuff. And we really do defer to them as to whatever the public health unit in that particular area is mandating or recommending that will be followed. So we will kind of defer to them for a lot of the guidance on it. Now, where things have gotten a little more difficult recently with Omicron is that the public health units are overwhelmed. So they are not doing a lot of the contact tracing anymore just because they can't. It's just far too much. So in terms of even dealing with outbreaks and that sort of stuff, I believe they will still deal with that, but it's not as simple now as it was in the past. And I realize I haven't really answered your question on that one, but we don't have a lot to do with sort of that claim side of it.
Yeah,
it's more WSIB.
And actually what you've done is provided a nice transition, because I think Ahed's going to give a presentation and then Amina's going to talk about the 3 levels of government and who's responsible for what. But I do want to thank you very much. I think you've been a resource throughout the pandemic, and whenever we have questions on enforcement, we always find our way to you. And so I really do appreciate you coming. And I think we had a lot of positive comments from potential participants when they heard that you were going to present. So thank you for this. And I think unfortunately, we're going to start bringing you back quite often. So, I know you're a busy guy, but I think we've just added something else to your job description. So we'll be in touch, and thank you for taking the time.
My pleasure, thanks.
And with that, I'm going to introduce kind of the rest of the ResCon COVID team. I guess I'll just introduce Ahed, and I think when Ahed's done, she's going to introduce Amina. But anybody who knows anything about ResCon, Ahed and Amina are the ones that kind of do the real work behind the scenes. And so Ahed's going to run us through the updated, what I call the vaccine cheat sheet. And so I will turn it over to her.
Hey everyone, so it's no secret that we are in another wave of this pandemic and the peak is yet to come. We won't know when necessarily it's going to begin or when it's going to end because of the testing situation right now. As Dr. Moody mentioned earlier, our best defense is just to continue social distancing, to wear our masks, and to make sure we get our boosters in time, and to encourage those around us to get it too. So what we've done, ResCon, to help you guys is we recreated the cheat sheet that we had originally created, I think on the 2nd or 3rd wave, lost count now. So I'm going to share my screen. I'm going to take you through the cheat sheet. It has links to all the different clinics, vaccination clinics that exist in Ontario. I'll just quickly share my screen to show you. Sorry. There. Can everyone see that?
Yes.
Yeah, perfect. So this is what the sheet looks like. It just says what the different age requirements for people to get the vaccine, whether you can get the 3rd dose or not, the different links to register, and then just comments on whether you need to book or not. So we covered Toronto, the different pop-ups that exist in Toronto, York Region, Peel region, and the different pop-ups that exist in Peel, Halton, Durham, and just also GoVax buses. For the GoVax, you can find links also to the schedules and the locations in different parts of Ontario. It tells you whether you need an appointment or not. And it's an extremely useful sheet. We have used it in the third wave and we got really good feedback. So I'll show you where you guys can find it. It's very simple. Just go to the ResCon website. You click COVID section, vaccinations, and it's here. This is it, the ResCon vaccine guidance. You click read more and it's right there. So, yeah, it's just simple. If you live in Toronto and you want to know where you can get it, you can either click here to get this will direct you to the Ontario system or to the different hospitals, or you can get a link to the different vaccine locations, and this will take you to all the information the City of Toronto has published regarding getting your vaccine and your booster. So we do update this on a very regular basis. And we share it out. We have it on our website and we share it out in our member emails. Just make sure you follow it and more importantly, share it with everybody. Next, also, as Dr. Moody had mentioned, it's extremely important to remain vigilant and to continue to do our workplace screening. Right now, the enhanced screening that we had with rapid testing isn't very available. However, we go back to the normal screening that we did with the surveys. The Ontario government has updated its survey. Right now, things like rapid tests, as mentioned earlier, are taken just as seriously as PCRs. So make sure you are updating your screening tool and that you're making sure that everybody in the workplace is actually filling it in. I'm going to add the link to the new survey in the chat. And that's it for me. I'm going to turn it over to Mina, who's going to give us kind of like a breakdown of the different levels of government and different rules that they can apply in terms of COVID.
Thanks, Ahed. Let me just share my screen. Let me try and make this full screen. Okay, never mind. Okay, so, I mean, we're in year 2 of the pandemic, and it seems like there's a new announcement every other day, whether that's from the federal government, the provincial government, or your local municipal government. And so we've had a lot of questions from members just about like each role in the pandemic. And so I'm going to go over that, especially since like it really does matter. Like if the federal government announces something, it doesn't necessarily always pertain to Ontarians or a workplace in Ontario. So the federal government, it's more or less broad. And it's less impactful on our day-to-day life. And so certain industries that the federal government does have almost complete control over include air travel, railroads, our ports. Obviously that includes our borders, that our international borders. So that was seen through travel restrictions, border closures, etc., as well as banking, telecom, and cross-border trucking. This isn't an exhaustive list, by the way. And then industries that are federally regulated follow the Canadian Labor Code. And so the federal government does have the ability to make amendments or changes to the Canadian Labor Code, and those industries that are regulated under the Canadian Labor Code must follow the code and the amendments or changes. And so, for example, late last year, the federal government announced that federally regulated workers would soon receive 10 sick days. So again, that's not Ontario. It's just federally regulated workplaces, which would go back to this list: air travel, railroads, ports, banking, telecom, and cross-border trucking, again, not exhaustive. Where the feds do play a really big role is procurement and distribution of vaccinations and rapid tests, and among other things, COVID-related PPE, broadly speaking. So moving on to the provincial government, I want to say give or take 90% of workplaces in Ontario do follow provincially regulated labor laws. So that includes the Employment Standards Act, the Occupational Health and Safety Act, the Human Rights Code for Ontario, and the Ontario Labor Relations Board. So obviously the provincial government has probably the largest impact on our day-to-day as it relates to most things, but specifically speaking the pandemic. Healthcare, education, public safety are really big ones. With education, obviously, school closures, virtual learning, et cetera. Healthcare, hospital, anywhere from health hospitals to vaccinations. As you saw, like from the start of the pandemic, the emergency orders, stay-at-home orders, lockdowns, business closures, those types of things the province has control over. And then tracking and reporting case counts, deaths, hospitalizations, and vaccination rates. So they track those rates province-wide. And then guidance and enforcement of provincially regulated workplaces. So like I said before, virtually 90% of workplaces in the province are provincially regulated. Most construction sectors included, and I say most because it's not all. And with saying that, the vaccination mandates, the number of sick days, again, go back to the provincial labor legislation. So these three here. And then municipalities. This is one thing that I was probably one of the first things I was taught in second year Canadian politics was that municipalities are the creatures of the provincial government. So the province sets laws that empowers municipalities with certain implementation and enforcement abilities. And then the municipalities are tasked with, again, implementing those laws. And so one of the big ones that the construction industry and really any workplace across the province was and still does have to be aware of is Section 22 of the Health Protection and Promotion Act. And so this Section 22 allows municipal public health units to issue partial or full closures of workplaces that have reported work-related COVID cases. So those Section 22 orders are still in place. It means that, for example, Toronto Public Health, if they find out of 2 or more workplace-related COVID cases, and they do an investigation, they can and do have the power to issue a full or partial closure of a workplace, including a job site. Municipalities are also responsible for testing, tracing, and tracking cases, administering vaccinations, and investigating public health violations. So if I were walking by a construction site and I saw someone not wearing a mask, I could report it to Toronto Public Health. I could also report it to the province through MOL enforcement. Same goes with like restaurants when they were open that did require proof of vaccination. If I went to an establishment that did require proof and didn't check, I could report that to Toronto Public Health. And then obviously the municipal governments can decide which municipal services stay open or close or go to remote. So at the beginning of the pandemic, we did see that many municipal building departments that were controlled building application permits, etc., did go online for a while. So I'll stop there. I hope that there aren't many questions, but if there are, you can just put them in the Q&A. Otherwise, I think we're at time now. So I'd just like to thank everyone for attending. I think this is our 5th COVID event. As mentioned earlier, the recording of today's webinar will be sent to anyone who RSVP'd within the next couple of days. It'll also be posted on our website under the events section. As always, please be sure to stay updated with ResCon news and updates by following us on Twitter, subscribing to our newsletter, and visiting the COVID-19 section of our website. Our next upcoming event is on March 3rd. It's our Housing Supply Summit. And so it'll be a half-day conference, which you'll hear from housing experts, politicians, and just hear more about the state of our housing crisis, supply crisis in the province. As many of the previous speakers said, Omicron is spreading at a rapid rate, and we can all do our part by getting vaccinated and helping the people around us get vaccinated. So whether that be a first, second, or booster doses. Thank you, everyone.
Okay. Thanks everyone for attending. We'll stop it here.